For an analysis, Associate Professor Hsu Li Yang joins us live now. He's Vice Dean of Global Health at the NUS Saw Swee Hock School of Public Health. Professor, great to have you with us. What is your sense, first off, of how much the inbound travel will likely worsen the current COVID-19 surge and the risks of new variants emerging?
Good morning. I think that China is facing its largest COVID wave for a long time, since Wuhan, in fact. And in this sense, the inbound travelers would really add very little to the numbers that are experienced in China.
What about when you think we will likely see a peak in the infections and the COVID-19 case counts? I mean, there were some estimates that we'd see this in the middle of January. Do you share those estimates?
I think we don't have any other better information to go by at this point in time. And certainly a prediction of the middle of January seems in line with what other countries have experienced when they open up, meaning that the peak of the wave comes several weeks afterwards.
Okay, so just looking at not just the, potential for the inbound travel, but also what's happening on the mainland currently, do you see the higher risk from, the emergence of variants? What is your sense of things on the mainland now?
I think that new variants may arise anywhere, and they have been, because there's a surge of cases in China currently. Suddenly there is a risk that new variants of COVID-19 or new subvariants of Omicron may arise from China and then spread to the rest of the world. But this risk is similar to other places where there's a rise in COVID cases as well.
Okay, from where you're sitting, how do you think we will know how bad it really is on the mainland, given that China is no longer releasing those daily COVID case counts? People that test positive with ARTs have no obligation to report. China has also narrowed how it classifies COVID deaths.
In some ways, your guess is as good as mine, but there will be reports on how the hospitals are coping in China. And I'm sure China's CDC will not stop reporting. It can't. It just won't be every day as they have done in the recent past.
Okay, what about those that are down with COVID-19 given the current surge, but there are reports of shortages of medicine on the mainland, people in Singapore sending medicines via couriers to their relatives. What can those who don't have access to some of these medicines do in the absence of Paxlovid or paracetamol?
I'm afraid it'll be very challenging. I know China and others are trying to ramp up production of these medications, but in the absence, there's really very little. People can drink more fluids, take in more water. That certainly helps. Rest and try to stay in a cool place. These are the usual measures that are taken when there's a lack of medicines like Panadol or ibuprofen that can bring down fever. Of course, if the fever is too high, then the persons who are sick should go to a hospital. This can't be helped despite the fact that China's hospitals are facing a current crunch in terms of the people attending the clinics.
And given the current crunch, what is the concern behind those that have critical conditions on the mainland and whether they can still get the urgent help that they need?
I'm afraid that that is going to be challenging. And this has happened everywhere around the world, including in Singapore. You may remember during our Delta wave, there was an issue with the bed crunch as well. China is trying to ramp up the number of hospital beds available, not just within hospitals, but in outside facilities. And there will be a need to triage patients based on how critical their illness condition is in terms of who gets the bed space and who gets the ICU.
And this latest relaxation is likely to see that spike in inbound travel, especially with Chinese New Year approaching. But what is your sense of whether people should be traveling just because they can?
we can talk about what people should do, but it really doesn't stop people from doing things. And I think that there's been, in some ways, people have been cooped up so long that they would want to travel, especially during Chinese New Year. I guess during this period, people should refrain unless it's absolutely necessary. But as I mentioned, there's really little way of stopping people from traveling short of government restrictions.
Okay, what about travel for vaccines? I mean, do you think we'll see an uptick in vaccine tourism, given the lingering concerns about the efficacy of Chinese vaccines?
This is already happening, as you have shown in the news. People are traveling from China to Macau to get vaccinations. And as quarantine restrictions ease, I'm sure there will be people traveling elsewhere to try to get the Western mRNA vaccines. Nonetheless, I think the key issue is to try to vaccinate as many of the people in China and to get booster vaccinations, especially for the elderly, as far as possible. Rather than travel overseas, for instance, for these mRNA vaccines that's going to be unavailable to many in China.
Okay, Professor, we'll leave it there for today. Thanks very much for sharing your time with us. Associate Professor Hsu Li Yang is Vice Dean of Global Health at the NUS Hsu Li Yang School of Public Health.